In a world where disease continues to pose significant challenges to human health, World Polio Day stands as a beacon of hope, illuminating the path towards eradicating a debilitating illness that has plagued humanity for centuries now. On this auspicious day, the world gathers to raise awareness and mobilize resources, as well as celebrate the remarkable progress made in the fight against polio. Well, joining us now to have this conversation is Dr. Philip Njemanze, Chairman, International Institute of Advanced Research and Training, Chidicon Medical Center. Thank you, Dr. Njemanze, for joining us.
Thank you for having me.
It's a pleasure. Now, today is World Polio Day. How has the establishment of this day contributed to the global effort to eradicate polio in itself?
Yes, today marks the journey that began in 1988 with the establishment of the Global Polio Eradication Program. This is a welcome thing because we have achieved a lot of successes. Nigeria has been declared polio-free. We now have Pakistan and Afghanistan as the only holdouts now, and a lot of progress is made in that direction. So, in order to commemorate this great success, it was in 2016 that we had the last case in a village in Borno. And then since then, we have been on due vigilance and surveillance for any wild type polio cases. So this is a great success. So far, we are still on vigilance and surveillance for any wild that might come. We hope not.
So, Philip, can you shed more light on the primary objectives of World Polio Day and the strategies that will be deployed to achieve these objectives?
Yes, the main issue here is to remind people that even though we have declared that we are polio-free, but polio is still a disease somewhere around the world is present. So if even one child is infected, still all children are actually at risk. So usually you have two cases of polio. One will end up with a very severe paralysis. Sometimes it will affect the respiratory muscles and have quite a high mortality rate. Such. So it is a dangerous.
Dr. Philip, I think we're having issues with your audio. Could you confirm you can hear us?
I can hear you very well.
All right, please go ahead.
Yeah, the fact that we have this success does not mean that we should let our vigilance fall. And this is what we do on the World Polio Day, to remind people that yes, we have had some very great success with this disease, but still around somewhere. And our children, especially those less than 5 years, are still at risk.
All right. Now, Dr. Philip, could you help us understand what role public awareness plays in fighting polio? We always talk about creating awareness. If people know a lot about polio to tackle it, you can't fight what you don't know. So what role does creating awareness play in fighting polio? And how does World Polio Day coming to help in that regard?
Yes, World Polio Day, as I said, is a reminder. And what are we observing? We are observing floppiness of the extremity, usually the leg, the lower leg. People will observe that the child around you has very floppy legs. And that is called the paralysis, plastic paralysis. So when you observe that, that's something that will actually set up an alarm bell, make you go to the hospital and have a doctor take a proper look at it, and then of course report the case. So by doing this public awareness program, we can have our eyes almost everywhere as parents and relatives will observe if there is any such child who is confident of the legs, uh, common and easily recognizable symptom.
There are certain countries, as we know, that are not well equipped enough to tackle a lot of viral diseases, including polio. Could you provide insight into some of the challenges that these countries will be facing, especially talking about countries with weak healthcare systems now in the fight against polio? Dr. Philip, are you there? Dr. Philip, can you hear us?
Yes, I can. Yeah, go ahead.
Oh, all right, please go ahead.
Yeah. Actually, I didn't get the question.
All right, so I'll give it another try. I was basically asking if you can help us understand the challenges that some of the countries that have weak healthcare systems, especially in Africa, face when it comes to fighting polio.
Yes, the main issue here we have in this country, and we also have these challenges, is insecurity. The hotspots of polio spread across the northern belt. These are the areas where you have a high degree of insecurity. So if you cannot visit these areas or have healthcare workers move around freely because of the insecurity, you will actually not be able to take the cases of time. So that is a major challenge here. And there are many areas in Africa where we have ungovernable spaces, maybe because of some kind of crisis or wars going on in these areas. These are usually the main issues. Take Pakistan in Afghanistan. It's also because of these insecurity problems that have developed for political reasons, all problems that come up in society. So the main issue is that polio and its susceptibility to full eradication and overall political atmosphere in the country. It's their country, then it's quite easy because humans are the reason of the infection. So if you can get to the people, you can actually get to eradicate it.
Now, Dr. Philip, as much as some countries are still suffering the effect of polio, maybe due to lack of equipment to tackle it or lack of awareness, there's on a global level, there is a level of advancement that has been recorded in medical technology and, of course, research. So how has this advancement and technological upgrade influenced the global polio eradication campaign?
Yes, I think we have a better system of tracking. Just take a simple one where you have your cell phone and have your cell phone using the global positioning system. We can actually track you to the nearest meter. So that is good enough. So because what we need to do is that we really need to know where the case infection are. So let's say somebody in one remote village or it takes the case, and as far as the person has a cell phone and can make a call, we can actually track where that is and then send off people to go there and be able to actually help manage the case or for permanent the nearest big hospital. So that helps a lot. However, even beyond that, I think also there is need to consider because not only are we having low incidence of the wild type, but we are also having acute plastic paralysis, the non-polio acute plastic paralysis. So those ones are usually due to related to the vaccine because in most places where we are oral OP, oral polio vaccine, this oral polio vaccine is a live vaccine. So in in people who are not immune or not properly immune by their con- uh, by their constitution, they might actually develop the polio after the vaccine. So the acute plastic paralysis from polio type can actually develop after the vaccine. People who are less immune. So in that case, they now use the IPV, which is the inactivated one. So it is inactivated, not live. And that IPV injectable, uh, it's much more efficient. So I think in this last phase of the disease, you will see a switch over to the IPV that the OP, and that will help us to the final stretch, the eradication.
We're basically talking about collaborative effort globally from national stage and everywhere else. So speaking of collaboration, how do you think that governments and international organizations can work together to support the countries facing polio outbreaks the most?
Well, actually, the provision of, for example, the I uh, it's not it's not a cheap vaccine by itself. And we have always advocated that the support of the health should come at what we call the common basket contribution. So when we actually appropriate some kind of aid for health, it's contributed and the country prioritizes which will deliver that aid that is coming in. So for those countries who have uh, are facing challenges with the polio disease, what they need to do is probably to mobilize all the aid they get to purchase the right vaccine and then be able to deploy for their people. So that will also help us all at the long run eradicating the polio virus. So I think there is room for collaboration. There needs to be far more transparency in also the vaccine regimen, the vaccine use, so that people will believe it. Uh, so once people believe it, there will be almost like a, a massive mobilization of people. So I think what needs to be done is the reassurance and actually people believing the very, very good use of this vaccine.
All right. I think I'm going to also ask what role vaccines play in eradicating polio because a lot of people do not seem to understand the importance of vaccines. And how do we ensure that areas, especially the rural areas, that do not have access to these vaccines, get them, evenly distributed to their region?
Yes, actually, there's there is no alternative to good governance. Basically, when we talk about there are multifactorial things. It's not just the vaccine. If you have vaccine and you do not have electricity or some way of supporting it, so it will be of no use because eventually the vaccine will get spoiled. They are not stored at a particular temperature. And if you have the vaccine and you don't have routes to those communities, so you also are stopped because you can those. So there is really no alternative to good governance. Uh, it's good governance that pays the road, good governance that provides life, all that. A whole company. So the vaccine by itself will not work much. Is basically the entire infrastructure, entire presence of electricity, roads, all the all the things that makes for good governance be there in place. So this will help eradication of any uh, polio. So I think what we need to be emphasizing is also hammering on speak about eradication of TB. Vaccines play a very important role. They have their and it's possible to deploy them, but to deploy them, you need all the infrastructure that's required to do that. And I think that going forward, the matrix of good governance is actually how good it affects the health of the people. If the people are not healthy, they have all sorts of people that actually is the mirror image that shows that they can.
All right. Thank you so much, Dr. Philip. Now, one final question, and I think I'm going to ask you personally. What do you hope that this day will achieve? Dr. Philip, are you there?
Okay, I didn't hear that because the line went off.
That's
okay.
fine. That's fine. I was just asking
that?
personally, in your own opinion, what do you hope that this day will achieve? Dr. Philip, did you get the question?
No, I didn't. Can you repeat that?
Yes, I will give it another try. So I was asking what you hope for this day to achieve, generally, the World Polio Day. What is your hope for this day?
Yeah, my hope is that it becomes a terror for that polio, we have made a lot of progress for the eradication. And also reminds us that we do a lot, actually do a lot of other area, all the other things that take us. But again, also shows that we have to work collaboratively as one world in order to make things happen. So I think humanity can take a reflection and say, wait a minute. Because it really means that we can actually eradicate most of these for a very long time. The answer is yes.
Right. All right. Okay, Dr. Philip Njemanze, Chairman, International Institute of Advanced Research and Training, Chidicon Medical Center. Thank you so much for joining us to discuss World Polio Day. And we do hope that all these things we've outlined are eventually achieved and even achievable as time goes on. Thank you so much.
Thank you for having me.